So a couple years ago, I had a little tiny pimple on the rim of my mouth. It's called the vermilion border. I thought this pimple would go away. Yeah, sure it did. And it came back. And then it came back. And then it looked like a cold sore. So I got on a cyclovir, right? Who wouldn't? The cold sore would come back over and over. And then it started getting angry and bleeding as well. Yeah, bleeding. Uh, I got tired of it. I got a giant abscess on the bottom of my mouth, in my gums. And this is part of it. So I went to the dermatologist finally. And he did a shave method where he shaved off the outer layers under my nose and on my vermilion border of my lip. And he called me back. And he said I had cancer. It's only basal cell cancer, so it's the lowest form of cancer for your face. Nevertheless, I have malignant carcinoma. Great, I'm 45. Not only have I lost my bottom two teeth at my age, I now have malignant carcinoma. A little freaked out, right? Now, I am a redhead. I have clear skin with freckles. My parents always took me out to the lake, and I hardly ever use sunblock. Yes, I'd go to the tanning salon when I was a teenager because I wanted that pretty glow that all the friends had. But apparently that was not the right thing to do. Now I do have a little tiny spot right here. They're going to look at that later because this was too traumatic. I went to see my dermatologist, and it was a little too much for him to handle, so he sent me to Grants Pass, Oregon, to a fabulous doctor named Dr. Heffaker. But after he talked to his team about this, it was too much for them to handle in their office. So they sent me to, ready? The Night Cancer Center in Portland, Oregon, at OHSU. That is a 7-hour drive from us. 7. But actually, it took us more like 8.5 hours. So, I have been a nervous wreck this whole time, and I'm shaky because I'm so nervous about this procedure. I've done all my research online like you're doing right now. This is terrifying. My face, my smile, everything I found out is kind of my identity. I can be fat, I can be skinny, I could whatever, change my hair color to blue, which I usually do. But this is me. This is my identity. Like, losing my teeth was traumatic enough. But I have fake ones that can sit in there when this heals. See the scar? Right there. And around the nose. That's a 6.5-inch scar with over 80 sutures. 80. They're underneath and they're on top. She took my whole face and went bloop all the way over. Because this started out with one little spot on my lip, then turned into a golf ball size shape. This big. Not joking. That big on my face. A golf ball size. Completely layered out. It took 2 passes. 2. To get all the cancer out. So while we're sitting in the lobby, full of people in the beginning, it then thinned out. And I was left with one other person. And she calls me back again and says, well, we didn't get it all. We have to go back in. The injections are the worst part. Yes, I could feel the snipping and the scalpel and the pulling and the stitches. And I could feel all of that. And the burning. But what was the worst? The worst thing that had me in tears was the injections. I'm not going to lie. Those things feel like a wasp sting. Over and over. And you know what helps? If they tap it. If they tap it, those injections to numb it are not as bad. So make sure you do that. You have them do that for you. Have them tap it. Okay? My doctor is Dr. Barr at the OHSU Knight Cancer Center in Portland. She is a teaching doctor. She is the best that I could have ever hoped for. And right now I'm a little self-conscious that I'm showing you this at all. I had this done on Wednesday. Today is Saturday. Yesterday was worse than today. Way worse. The swelling was this giant goose egg. I couldn't even see past my eyeball. So it's come down a little. Ow. Ow, that hurt. The top lip was just massive, and this was underneath. Now, I still can't eat without using a straw. So, yep. Fruit and veggie protein powder with the straw. Mashed potatoes works well. Anything soft that can go through a straw or a baby rubberized spoon would be great. My nose, as you see, yeah, that was a little shocking because I liked my nose before. This is supposed to relax and go back. It should go back to normal. I don't know how much this will go down, but if I get a lip job out of it where it's more puffy, then cool. I guess that's the fad, right? I'm 45. Why not have some puffier lips? This will heal. In a month or month and a half, she wants me to come back and get laser treatment, which is going to help soften and de-redden this area and maybe make the scars less prevalent. I want to tell you right now, the biggest thing you can do for yourself is ibuprofen 800 in between the doses of painkiller and antibiotics they give you. Ice packs, ice packs, ice packs, ice packs. I cannot tell you enough ice packs. This is what I'm using. Yep, I'm using that giant ice block. I have 2 of them. They do provide you with small ones, and they do provide you with bandages. Luckily, I work in an emergency room, and I also have face masks that go around my ears. Just little, because I'm really embarrassed about all of this. It's scary. This is my face. Want to see something cool, though? Right there. That's what, right there. That's my new lip. When I touch that, when I go like that, I can feel that all the way across my lip. All the way across. Nerves are amazing. Okay, and there's a spot right there. Right there. When I touch it, it feels like I'm touching right here. Now, yes, the injections hurt. The most painful part for me was the injections in and around the nose. There's so many nerve endings there. I'm not going to tell you this was easy. This was not easy. This is terrifying. And they don't prepare you for this. Oh yeah, we're going to clip and cut and it's going to be good and we're going to get rid of this. And yes, that's true. It's going to be great. When it's done healing, it's going to be fabulous. The cancer's gone. I don't have cancer there anymore. Thank God. But what they don't prepare you for is the swelling. And my husband has turned off the lights. So now I'm glowing with the TV colors. So I'll let you go. Ice. Thanks for joining me. And you're better now. The swelling will go down. And you're going to look great.